But here is the exception. Here is the one that matters. If a single dark vertical line appears on one nail, particularly a single brown or black line that runs from the cuticle to the tip, this is something that requires prompt evaluation. This kind of line can sometimes represent a benign pigment change, particularly in people with darker skin tones, where pigmented lines on the nails are more common and often harmless. But it can also represent a melanoma, which is a serious form of skin cancer that can occur in the nail matrix itself. Subungual melanoma, as it is called when it occurs under the nail, is rare but serious. It is one of the few nail findings that always deserves prompt medical evaluation, not at your next routine visit, but as soon as reasonably possible. And it is notoriously easy to miss because it hides in a place where most people never think to look for cancer, and because it can be mistaken for a bruise, a stain, or a harmless pigmentation change. The difference between catching this early and catching it late can be the difference between a straightforward treatment and a far more serious outcome. But there are 5 more changes we need to cover, and the next one involves something at the very base of your nail that you have probably seen your entire life without knowing it had a name, or that it could reflect what is happening in your heart, your lungs, or your liver. If you see a new dark line on a single nail, particularly if it is widening over time, changing color, becoming irregular in its borders, or extending into the skin around the nail fold, please see a dermatologist or your doctor without delay. Catching this early can be genuinely life-saving. I cannot emphasize that strongly enough. The difference between an early-stage melanoma confined to the nail matrix and one that has spread deeper is a difference in treatment options, in outcomes, and in survival. And that difference can come down to how quickly someone noticed the line and acted on it. Now, I want you to look at your nails again. Look at each one individually. Are there any dark lines? Any single lines that stand out from the rest? If you see one, do not ignore it. Do not assume it is nothing. Do not wait to see if it goes away on its own. Make an appointment. Get it evaluated. The worst case is that you spent an afternoon at a dermatologist's office and it turned out to be benign. The best case is that you caught something serious at its earliest, most treatable stage. The 5th change involves the half-moon shape at the base of the nail, that pale crescent that most people have at the base of at least their thumbnails. This area, called the lunula, is actually the visible portion of the nail matrix. It is the part of the matrix that you can see, the part that has not yet been covered by the skin fold at the base of the nail. And changes in the lunula can sometimes reflect changes in overall health, although the connection is less clear than for some of the other findings I have discussed. A lunula that has become unusually pale or has disappeared entirely is sometimes associated with anemia, malnutrition, or certain other conditions that affect the body's overall nutritional and metabolic state. A lunula that has become red or unusually colored can be associated with certain conditions affecting the heart, the lungs, or the liver. These color changes are thought to reflect alterations in blood flow or in the composition of tissues in that area. But I want to be very careful here because the lunula varies significantly between individuals. Some healthy people have prominent lunulas on every nail, visible and obvious on each finger. Others have them only on their thumbs. Others have them barely visible anywhere. The absence of a lunula by itself in someone who is otherwise healthy is not necessarily concerning. It may simply be your normal. What to watch for is a change. If your lunulas used to be clearly visible and have disappeared over time, or if they have become a different color from what you remember, that is worth mentioning to your doctor. The change is more meaningful than the absolute appearance. This is a principle that applies to almost everything we are discussing today. What matters most is not what your nails look like compared to someone else's, but what they look like compared to how they used to look. Your nails have a baseline that is unique to you, and deviations from that baseline are what carry significance. The 6th change is one that, when present, is among the more striking findings in all of clinical medicine. Nails that have become unusually pale or that have lost their normal pink color across most of their surface. This is sometimes called Terry's nails, particularly when the nail appears mostly white with a thin band of normal pink remaining at the very tip. It looks as though someone has painted the nail white but left a narrow strip of color at the end. The effect can be subtle or quite dramatic, depending on how advanced the change is. This finding is associated with serious medical conditions, including chronic liver disease, particularly cirrhosis. But it is also associated with congestive heart failure, diabetes, and kidney disease in some cases. The mechanism is thought to involve changes in the blood flow to the nail bed and changes in the connective tissues that lie just beneath the nail. Whatever the exact cause, the visible result is a nail that has lost much of its healthy pink coloration and taken on a washed-out, pale appearance. If your nails have lost most of their normal pink color and look pale or whitish across most of their surface, this is something to bring up with your doctor. The underlying causes are often serious, and early evaluation matters. This is not a change to monitor at home for weeks or months. This is a change that deserves a medical conversation reasonably soon. But there is another color pattern that is even more specific, even more diagnostic, and it involves a nail that is literally divided into two halves, each a different color, the bottom half pink, the top half white, a sharp line between them. When you see this pattern clearly, it is one of the most specific nail findings in all of medicine, and it points directly to a particular organ system. If you have never heard of half and half nails, what I am about to tell you next could be one of the most important things you take from this entire conversation, especially if you or someone you know has kidney problems that have been brewing quietly, without symptoms, for years. Your kidneys could be struggling right now, and the only visible clue might be sitting on the surface of your fingernails. The seventh change involves a different and very distinctive color pattern. Half and half nails, where the bottom half of the nail looks normal pink and the top half looks distinctly white or pale. The two sections are separated by a visible line, giving the appearance of a nail divided into two distinct zones of color. This pattern is particularly associated with chronic kidney disease, and it is one of the more specific nail findings in medicine. While many nail changes can have multiple possible causes and require careful interpretation, half and half nails have a relatively strong and direct connection to kidney function. The mechanism is thought to involve the accumulation of certain substances in the blood that the kidneys are no longer filtering effectively, leading to changes in the nail bed that produce this characteristic two-tone appearance. If you see this pattern on your nails, particularly if you also have known kidney problems, swelling in your legs or face, changes in your urination patterns, or fatigue that is not explained by other causes, please see your doctor for an evaluation of your kidney function. A simple blood test and a urine test can reveal a great deal about how well your kidneys are working, and chronic kidney disease is one of those conditions that can progress silently for a long time before symptoms become obvious. Your kidneys are remarkable organs that work constantly to filter your blood, regulate your blood pressure, and maintain the balance of fluids and minerals in your body. When they begin to fail, the early signs can be incredibly subtle. A little fatigue, some swelling, changes in the color of your nails that you might dismiss as nothing. But chronic kidney disease is a condition where early intervention can significantly slow progression and preserve function. The earlier it is detected, the more options are available, and your nails might be giving you a clue long before anything else does. The eighth change is one of the most common and one of the most often misunderstood: yellow nails. Nails that have taken on a yellowish color across their entire surface or in patches. The most common cause of yellow nails is a fungal infection, which is extremely common, particularly in toenails, and which is not generally dangerous but can be persistent and difficult to treat. Fungal infections can produce yellowing, thickening, crumbling at the edges, and a generally unhealthy appearance. The nail may become thicker than normal, may develop an irregular surface, and may begin to separate from the nail bed underneath. If you have noticed these changes primarily in your toenails, particularly if you have a history of athlete's foot, excessive moisture exposure, or activities that keep your feet in warm, damp environments, a fungal infection is the most likely explanation. Less commonly, yellow nails can be a sign of a condition called yellow nail syndrome, which is a rare disorder associated with chronic respiratory conditions and problems with the lymphatic system. In this syndrome, the nails become yellow and thickened, and the condition is accompanied by respiratory symptoms such as a chronic cough or fluid accumulation in the lungs or elsewhere in the body. In some patients, yellow nails reflect chronic exposure to certain chemicals, including some used in nail products and polish removers. In others, yellowing can be associated with diabetes or thyroid conditions. The key is to look at the context. Is it one nail or all of them? Is it only the toenails or the fingernails as well? Are there other symptoms present, or is this an isolated finding? If your yellow nails are most likely fungal, your doctor or a dermatologist can confirm this and discuss treatment options, which may include topical medications, oral medications, or in some cases, procedural approaches. If they have developed without an obvious cause and are accompanied by other symptoms, particularly chronic cough, shortness of breath, or swelling, a broader evaluation is worth doing. Now, we have covered color changes and shape changes, but what about texture? What about nails that break, split, peel, or crumble at the slightest pressure? Most people assume brittle nails are simply a cosmetic annoyance, a result of too much hand washing or not enough moisturizer. And sometimes that is exactly right. But there is a particular condition, one that affects millions of people, many of whom do not know they have it, where brittle nails are one of several quiet signals that the body sends. It involves a small gland in your neck, and it can affect everything from your weight to your temperature to your mood. And if your nails have become brittle along with feeling cold all the time, or noticing your hair thinning, or experiencing unexplained changes in your weight, what I am about to tell you next could answer questions you have been carrying for a long time. The ninth change connects your nails to one of the most underdiagnosed conditions in modern medicine, and the connection is hiding in plain sight. The ninth change is one that affects many people without their realizing it carries any medical meaning. Brittle nails that split, peel, or break easily. While many things can contribute to brittle nails, including frequent hand washing, exposure to harsh chemicals and cleaning products, cold, dry weather, and aging itself, persistent and significant nail brittleness can sometimes reflect underlying conditions that deserve attention. Thyroid disease, particularly hypothyroidism, is a common cause of brittle, slow-growing nails. The thyroid is a small, butterfly-shaped gland in the front of your neck that produces hormones regulating your metabolism. When it is underactive, when it is not producing enough thyroid hormone, everything in your body slows down. Your heart rate may decrease, your digestion may slow, your skin may become dry, your hair may become coarse and thin, and your nails may become brittle, weak, and slow to grow. Hypothyroidism is remarkably common, particularly in women, and particularly as people get older. Many people have it for years without knowing, because the symptoms develop so gradually that they attribute them to aging, to stress, to being out of shape. They feel tired, they feel cold, they gain weight without changing their habits, their skin dries out, their nails break, and they assume it is just life. But it is not just life. It is a treatable condition, and the treatment for most people is a single daily pill that replaces the hormone their thyroid is no longer producing adequately. If your nails have become significantly more brittle than they used to be, particularly if the change is accompanied by other symptoms like persistent fatigue, cold sensitivity, hair changes, dry skin, weight changes, or a general sense that your body is running slower than it should, please bring it up with your doctor. A simple set of blood tests, including thyroid function tests, can often reveal the cause quickly and clearly. Iron deficiency can also produce nails that are weak and prone to splitting, which is why it appears more than once in this conversation. Iron is essential for so many functions in the body, including the healthy growth of skin, hair, and nails, and a deficiency can manifest in multiple ways across multiple systems simultaneously. The 10th and final change I want to discuss involves small dents or pits scattered across the surface of the nail. This is called nail pitting, and it looks as though someone has taken a tiny ice pick and pressed small indentations into the nail surface. The pits may be shallow or deep, few or numerous, and they may appear on one nail or several. Nail pitting is most strongly associated with psoriasis, a common inflammatory skin condition that can affect the nails even when the skin disease itself is mild or not immediately obvious. Psoriasis is an autoimmune condition in which the immune system causes inflammation and accelerated turnover of skin cells. When this process affects the nail matrix, it produces irregular growth that manifests as these small pits on the nail surface. Many people with psoriasis are aware of their skin involvement, but some have primarily nail involvement with minimal or no visible skin lesions. In these cases, The nails may be the only visible sign of an underlying inflammatory process. Nail pitting can also occur in other inflammatory conditions, including certain types of arthritis, particularly psoriatic arthritis, which can cause joint damage if left untreated. If you see pitting in your nails, and you also have any history of psoriasis, joint pain, morning stiffness in your joints, or skin conditions that have not been fully evaluated, please mention the nail findings to your doctor or dermatologist. They are part of a larger picture that benefits from a thorough assessment, and early treatment of inflammatory conditions can prevent long-term joint damage and other complications. I want to take a moment now and offer some important context because I do not want to leave you scrutinizing your nails with anxiety after this conversation. The vast majority of nail changes in healthy adults are minor and harmless. Small variations in shape, color, and texture are normal. Single ridges or marks that come and go are usually not significant. Changes that develop slowly with age are often just that, changes that develop slowly with age. Your nails are not supposed to look perfect. They are supposed to look like yours. The findings I have described are most meaningful when they are clearly present, when they appear suddenly or progress over time, and when they are accompanied by other symptoms or known medical conditions. A single, mild ridge on one nail does not mean you have a serious disease. A slight variation in color on one nail is not necessarily a sign of organ failure. What matters is patterns. What matters is changes. What matters is the context of everything else your body is telling you. Take a look at your nails. Go ahead, I will wait. Right now, wherever you are, hold your hand up in front of your face and look at your fingernails. The color, the shape, the texture, the way the skin meets the nail at the base, the lines, if any, running across them, the half-moon shape at the bottom of each nail, the way they curve or do not curve across their surface. Most people, even people who pay close attention to their health, have never really looked at their nails. They cut them, they paint them, they notice when one breaks, but they have never paused to consider that those small, ordinary surfaces at the ends of their fingers are one of the most quietly revealing windows into the rest of their body that medicine has ever discovered. I want to change that today. My name is Dr. Jane, and I want to walk you through what physicians have known for a long time, but rarely share with patients in a clear, practical way. Your nails carry information. They reflect, sometimes subtly and sometimes dramatically, what is happening inside the rest of your body. And learning to read them, even in a basic way, is one of the simplest and most underrated skills in personal health awareness. By the end of this conversation, you will look at your own hands differently. You will know what to watch for. You will understand which changes are harmless quirks and which deserve a conversation with your doctor. And you may, depending on what you find, catch something quietly important that would otherwise have gone unnoticed for months or even years. Stay with me. This is one of the more interesting conversations we have had together, and the information is genuinely useful. But before I walk you through the specific nail changes that matter, let me explain why your nails reveal so much in the first place. Because once you understand the mechanism, the rest will make sense in a way you will never forget. Your fingernails grow from a region called the nail matrix, hidden beneath the skin at the base of each nail. The cells in this matrix are constantly dividing and producing a hardened protein called keratin that becomes the nail itself. As new cells are made at the base, the older nail material is gradually pushed forward, growing outward over the course of weeks and months. The full length of a fingernail from base to tip represents roughly 6 months of growth for the average adult. That means the nail you are looking at today is essentially a 6-month record of what has been happening inside your body. Periods of illness, periods of stress, periods of poor nutrition, periods of organ trouble. All of these can leave their fingerprints on the nail in ways that are visible to anyone who knows what to look for. The nail bed beneath the visible nail is rich with tiny blood vessels, which is why healthy nails have that familiar pink color. Changes in circulation, in oxygen levels, in liver and kidney function, in heart function, in inflammation throughout the body, all show up in the nail bed and in the nail itself. Your nail is a sensitive surface that quietly reports on the conditions inside your body. And learning to read it is like being given a free diagnostic tool you carry with you all the time. Are we together on this? Then let me walk you through what to look for. The first change I want you to know about is one of the most well-known among physicians and one of the least known among patients: spoon-shaped nails. Nails that have developed a noticeable curve inward so that the surface dips down in the middle, sometimes deeply enough that a small drop of water could rest in the depression without running off. This pattern, called koilonychia, is most commonly associated with iron deficiency, particularly long-standing iron deficiency anemia. The mechanism is not fully understood, but the connection is well documented. When the body has been low on iron for a long period of time, the nail matrix produces a softer, more pliable nail that, instead of growing in its normal, slightly convex shape, begins to flatten and then to curve inward. Other less common causes of spoon-shaped nails include certain conditions affecting the thyroid, certain genetic conditions, and exposure to certain chemicals over long periods. But by far the most common cause in everyday medical practice is iron deficiency, often combined with other nutritional deficiencies. If you look at your own nails right now and notice this pattern, particularly if you also feel unusually tired, short of breath with activity that did not used to bother you, or have noticed your skin looking paler than it used to, please see your doctor and ask for a check of your iron levels and a complete blood count. Iron deficiency is one of the most common and most easily treated conditions in medicine, and catching it through your nails is often the first step toward feeling significantly better. But spoon-shaped nails are just the beginning. There is another nail change that is far more striking when you see it, and far more important when you understand what it could mean. It involves a transformation so subtle that most people never notice it happening to their own fingers, yet so significant that physicians consider it one of the most important findings in all of physical examination. It is associated with conditions affecting the lungs, the heart, and in some cases, certain forms of cancer. And there is a simple test you can do right now, in the next 10 seconds, that might reveal something about your health that no one has ever told you to check. I will show you that test in just a moment, but first, I need you to understand why this particular change is so deeply connected to what is happening inside your chest. If this is the first time you are hearing about this, you are not alone. Most of my patients, even the ones who come in for regular checkups and consider themselves health conscious, have never been shown this test. They have never been told that the shape of their fingertips could carry information about their lungs or their heart. And that is exactly why this conversation matters. So if you are still looking at your hands, keep them right there. Because what I am about to show you next is something I was taught in medical school, something every physician learns early in training, and something that almost never gets shared with patients in a way that is clear and actionable. You are about to learn it. And once you do, you will never look at your fingers the same way again. But before I reveal that test, there is something else you should know about how this change creeps in so quietly that even the people closest to you might miss it for years. The change I am about to describe does not happen overnight. It creeps in slowly, over months or even years, which is precisely why it goes unnoticed. The people around you might see your hands more often than you do, and even they might not register the difference until someone points it out. That is how subtle it is. And that subtlety is what makes it both dangerous and remarkably useful. Dangerous because it can be ignored for years. Useful because once you know what to look for, it becomes one of the earliest warning signs your body can offer. The second change is one of the most striking when you see it in person, and one of the most important findings in all of clinical medicine. It is called clubbing. Clubbing is when the fingertips have become rounded and bulbous, and the nails have developed a more pronounced downward curve, so that the angle between the nail and the skin behind it has flattened or even reversed. The fingers begin to look almost like drumsticks, with the tips widening and the nails curving downward to wrap around the enlarged tissue beneath them. There is a simple test you can do at home right now. Place the backs of your hands together with your 2 index fingers touching, fingernail to fingernail. In normal anatomy, there should be a small diamond-shaped gap visible at the base of the nails where they meet. You should be able to see a tiny window of light between the 2 nails. In clubbing, that gap disappears completely. The nails meet flush against each other with no visible space between them. Try it, right now. Put your index fingers together, nail to nail, and look at the base where they meet. Is there a small diamond-shaped space, or do the nails press together without any gap at all? That small space, or the absence of it, carries more medical information than most people would ever imagine. Clubbing is one of the more important findings in physical examination because it is associated with a range of serious medical conditions, particularly conditions affecting the lungs and the heart. Chronic lung disease, including certain types of lung cancer, chronic infections, and conditions like cystic fibrosis. Heart conditions, including certain congenital heart defects, and conditions that lower the oxygen content of the blood. Some liver and digestive conditions can also produce clubbing in less common circumstances. If you look at your fingers and see clear clubbing that has developed over months or years, this is not something to ignore. Please see your doctor for a careful evaluation. The cause may be something benign and stable, but it deserves to be checked because some of the underlying conditions are serious and benefit enormously from early diagnosis. I want to tell you about a patient I will call Mr. Robert. He was a 60-year-old man who came to see me for what he thought was a routine annual visit. He felt mostly fine. He had no specific complaints, no pain, no cough, no weight loss, nothing that would have brought him to a doctor on his own. But when I examined his hands, I noticed that his fingernails had developed clear clubbing, with that rounded, bulbous fingertip appearance and the loss of the normal angle at the base. I asked him how long his fingers had looked like that. He stared at his own hands as if seeing them for the first time. He had not noticed any change. His wife, who was in the room, said she had thought his fingertips looked a little different in recent years, but had not known what to make of it. She assumed it was just part of getting older. We did a thorough evaluation. A chest X-ray revealed a small mass in his lung that, on further investigation, turned out to be an early-stage cancer. Because we caught it at that stage, his treatment options were significantly better than they would have been if we had waited for symptoms to develop. If we had waited until he started coughing, until he felt pain, until something obvious forced him to seek help, the story might have been very different. I am not telling you this story to alarm you. Clubbing is not common, and most people watching this will not have it. But I am telling you because this is exactly the kind of situation where paying attention to your nails can change someone's life. The clubbing was the first clue. Everything that followed, the imaging, the biopsy, the diagnosis, the treatment, all of it flowed from noticing a change in the shape of a man's fingertips. That is what I am asking you to consider today. Not paranoid scrutiny, not anxious self-examination every morning, but informed observation, the kind of awareness that catches things early enough to matter. Now, clubbing and spoon-shaped nails are changes in the shape of the nail. But what if the shape is normal and instead there are lines running across the surface? What if your nail has a groove in it that you have never noticed before, sitting there like a quiet timestamp of something that happened to your body months ago, something you might not even remember? That is the third change, and it might be the most fascinating one of all, because it turns your nails into a living calendar of your own health history. But to understand what those lines mean, you need to know what was happening inside your body when they formed. And the answer to that question might surprise you more than anything else in this conversation. Your nails have been keeping a record of events you may have completely forgotten, and the evidence is sitting right there in front of you, etched into the surface of a structure you trim without thinking twice. The third change involves the appearance of horizontal grooves or lines running across the nail. These are called Bowes lines, and they are essentially timestamps of stress on the body. When something significant happens to your physiology, whether it is a serious illness, a high fever, a major surgery, severe emotional stress, or certain medical conditions, the nail matrix can temporarily slow its production of keratin. The result is a depression or groove that forms across the nail at that moment in time, and then grows out with the nail over the following months. Think about that for a moment. Your nail is recording history. Every serious illness, every major physiological event, every period of intense stress leaves a mark that slowly travels from the base of your nail toward the tip, visible for months afterward, like a ring inside a tree trunk. If you see a single horizontal line across your nails, particularly if it is at the same position on multiple nails, you can often estimate when the event happened. A line halfway down the nail probably reflects something that happened about 3 months ago. A line near the cuticle reflects something more recent. A line near the tip reflects something from 5 or 6 months ago that is almost done growing out. A single Bowes line that is grown out and is moving toward the tip of the nail is usually nothing to worry about, particularly if you can remember a significant illness or stressful event from the appropriate time period. A bad case of the flu, a surgery, a period of extreme grief or anxiety. Your nail simply paused its production for a brief window, and that pause is now traveling outward as the nail continues to grow. But multiple parallel lines suggest something different. They suggest repeated stresses or a chronic condition that has caused intermittent disruption to nail growth over a longer period. Instead of one event, there have been several, each leaving its own groove, creating a pattern of lines that tells a more complex story. In some cases, deep or particularly noticeable lines can be associated with conditions like diabetes, peripheral vascular disease, or zinc deficiency. If you see multiple Bose lines and cannot identify obvious causes, or if the lines are accompanied by other symptoms, please mention them to your doctor at your next visit. They are not always a cause for concern, but they are part of the story your body is telling, and a careful physician will know how to interpret them in the context of your overall health. Now, Bose lines run horizontally, but there is another type of line that runs vertically, along the length of the nail, and this is where the conversation takes a turn that I need you to pay very close attention to. Because most vertical lines are completely harmless. They are a normal part of aging, nothing more. But there is one specific type of vertical line that is not harmless at all. It is rare, but when it appears, it is one of the few nail findings in all of medicine that demands immediate attention. It can represent a form of skin cancer that most people have never heard of, one that hides beneath the nail where you would never think to look for it. And by the time it becomes obvious, it may already be advanced. I will tell you exactly what that line looks like and how to distinguish it from the harmless kind in just a moment. But first, let me explain the normal version, because I do not want you to panic over something that is almost certainly nothing. The fourth change is one that often causes alarm, but is usually completely benign, with one critical exception. Vertical ridges running along the length of the nail. Most adults, particularly as they get older, develop some degree of vertical ridging. The nail surface, instead of being completely smooth, shows fine lines running from the base toward the tip. In most cases, this is simply a normal part of aging, similar to the way skin develops fine lines and texture changes over time. The nail matrix changes slightly with age, and the result is a slightly ridged surface that is entirely harmless. If your vertical ridges are mild, if they have developed gradually over the years, if they appear on multiple nails in a similar pattern, they are almost certainly nothing to worry about. They are your nails aging, the same way your skin ages, the same way your hair changes. It is a normal process, and it does not require treatment or concern.